All right, so starting the elbow evaluation, first we want to take the past history and present history of the patient. Next, we want to inspect for any swelling, discoloration, deformity. Then we also want to inspect the carrying angle. The carrying angle is basically just how they walk into the clinic, or however, what position they hold their arm. So for example, they can have their arm kind of like this, like coming into the clinic, or they can even have it like this, kind of out like that. That's also known as gunstock deformity. Next, we want to palpate. So starting with the bony palpation, we will go to the bicipital groove of the humerus, right here. And we'll go down the the shaft of the humerus. And then to the medial part. Medial part be like right here, the medial epicondyle of the humerus, and then the lateral epicondyle of the humerus. Then we want to look for the olecranon fossa of the humerus. It's going to be this right here is the olecranon process, and then inside or below it is going to be the olecranon fossa of the humerus. So this is the olecranon process, and inside is the olecranon fossa. Next, we want to do the ulna. So we'll start here, make our way down the shaft, go to the medial part of the arm, and then we'll palpate the proximal and the distal. Then we'll do the same thing for the radial side. So we'll go down the shaft, and then we'll palpate the proximal and the distal part. Next, the soft tissue. So we want to palpate the biceps brachii, the triceps brachii, and the back, the posterior part of the arm. Next is the wrist flexors. So I have a picture of him right over here. The wrist flexors, you would want to palpate from the anterior side of the forearm. Going down is going to be the pronator teres. It's going to be kind of like going down over here. And then the flexor carpi brachialis, going down over here. And then the palmaris longus. So we're going down kind of like right over here, and then down the hand, and then the flexor carpi ulnaris, which would be like right down over here, going down here. Then for the wrist extensors, you want to go to the posterior side of the forearm. The wrist extensors, you want to look for the extensor carpi radialis. So it'll be the so we'll be going down here, and then we'll be going the extensor carpi ulnaris, which would be the other side, and then the extensor digitorum longus will be going down the middle over here, and then down into the hand to each finger right over here. Next, the brachialis. So it's going to be underneath the bicep, and palpate it like this. It's going to be underneath the bicep. Then the brachioradialis. So if you form your arm into a fist, you'll be able to see it flexing, and so it will be about right here. The ulnar nerve. If you go to the medial part of the arm here, there's going to be a divot here. There's going to be the ulnar nerve. If you ever hit your elbow, you hit the funny bone. The ulnar nerve will send signals down the arm, down the fingers, and you should be able to feel like tingling in the fingers. Then the medial collateral ligament will be on the medial side, or then over here. And the lateral collateral ligament on the lateral side, of course. This is also known as the UCL and the RCL, or the ulnar collateral ligament and the radial collateral ligament. Then the annular ligament. So if you go up the radial side of the arm, palpate up here, it's gonna be that right there. Next, we're gonna test for range of motion. We're gonna do this passively and actively. We're gonna do this, it's gonna be passively and actively with the patient right now. We're gonna be doing it actively. So we'll start with 155-degree elbow flexion. So go ahead and flex your arm like that. Next is the elbow extension. The elbow flexion. You go 155 degrees, we'll go up. And then the elbow extension will go back down to 0. Next is a forearm supination. So go ahead and have your hand like that. And then like you're opening a book, 90 degrees. Then forearm pronation, closing it 90 degrees. Next, we'll test muscle strength. So by putting an arm, we'll do elbow flexion. Put your arm here, and then go ahead and hold your hand out like that. And then you want to push up against me. So go ahead, go up, 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 up. That works on the biceps brachii, brachialis, and brachioradialis. Next is the elbow flexion. So we're going to push down on your hand, push, 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 push. That works on the triceps brachii and the anconeus. Next, we'll do the forearm supination. So I'm going to hold your elbow here, and then you want to open your hand like that while I push against you. So go ahead and push, 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 push. Okay, that works on the supinator and the biceps brachii. Next is the forearm pronation. So we're going to do the same thing, just opposite way. I'm going to hold against you. So go ahead, push, 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 push. Good. So that works on the pronator teres and the pronator quadratus. Next, we're going to do neurological testing. So if you want to just follow what I'm doing, we're going to C5 deltoid, like this, just your elbow, like this. Go up, okay? And then the wrist extensor group, so we'll extend our wrist. Then the triceps, so we'll go like that, okay, flex the triceps. Then the wrist flexors, finger extensors, finger flexors, and finger adduction and adduction, like that. Okay. Next, we're going to do sensory. So if you hold the hand, in the anterior view, we'll go down the C5. Oh, please. Sorry, I'm going to switch spot. So we'll do C5, C6 is the thumb, 7 middle finger, 8 the 5th finger, and then T1 on up the medial side of the forearm. Next is we're going to test for reflexes. So start with C5, biceps tendon. So there, biceps. Next, test for the brachioradialis tendon. Right there, get reflexes. And then the C7 tendon will just be, of course, C7 triceps tendon will be on the triceps, so back here, and you'll test for reflexes there. Next, we're going to take a blood flow test. So we'll take the radial pulse. You would want to get their time for about 15, their rate for about 15 seconds. Whatever you get, you multiply that by 4. So for example, we'll do this real quick. Start at 15 seconds. So we'll just start now. All right, so that's about 15 seconds. I counted 20. So let's say 80 beats. It's strong and normal. Next, we'll do the capillary refill or the Allen's nail bed test. What you want to do, if you want to show the camera, get the fingernail, press down on it, and then the blood should be back up within 2 seconds. If they have any nail polish, go ahead and just flip the hand around and just do the same thing. Push down, should be coming back in 2 seconds. Less than 2 seconds.